Hello there, my name is Sam Hoare. I'm a pharmacologist and scientific consultant. In this presentation, I will introduce my consulting services, showing how I support drug discovery and research with scientific insight and experience from 25 years working in the pharmaceutical and life sciences arena. As we know, drug discovery is a problem-solving process. We move our projects forward until we hit an issue, we solve the issue, and then we move forward. I can help with the pharmacology issues on your drug discovery projects. Here's an example from a project I was involved with where we hit a roadblock with in vivo efficacy. This is from a study we published on the CRF1 receptor from an antagonist drug discovery program at Neurocrine Biosciences. The graph here shows the in vivo efficacy in rats for one of our first clinical compounds, NBI 30775. This compound demonstrated strong inhibition of a CRF1 biomarker response in vivo. Unfortunately, this compound was discontinued for tox reasons, so we started a backup campaign. Here are the first leads we identified. For the in vitro pharmacology, we used a binding assay, and we identified compounds with similar binding affinity as our first compound, as you can see in this list. We then tested these compounds in vivo, and here are the results. We were disappointed to see the new compounds did not work very well in vivo, as you can see here, despite these molecules having good PK. We solved this problem when we discovered our binding assay wasn't reporting the affinity correctly. This occurred because of binding kinetics. Specifically, the residence time of the molecules on the target was really long for some of our most active compounds. For example, the target residence time was 4 hours for our first clinical compound here. We fixed this problem by using a kinetic assay to measure the affinity correctly, as you can read about in the paper. Here in blue is the true affinity of our molecules from the new assay. As you can see here, these molecules which performed poorly in vivo bound with much lower affinity to the target, by up to 100-fold here. This provided us a simple solution to the problem and enabled us to move forward. We then used this new improved binding assay to find molecules which worked well in vivo. Here we have compound 6, which bound with a high affinity of 0.3 nanomolar. This compound worked in vivo as effectively as our original compound. This approach ultimately led to success in phase 3 for this target with an outstanding molecule called crinecerfont. This compound binds with picomolar affinity and a 10-hour residence time. The FDA recently approved this molecule for treating an endocrine disorder, CAH. The CRF1 antagonist story is a good example of how solving issues with the pharmacology contributed to the development of an effective treatment for patients. I can support your pharmacology in drug discovery, from early optimization through to late-stage development, including the design of the pharmacology strategy for particular targets. I can help with new advanced pharmacology, for example, allosteric modulators, biased agonism, binding kinetics, and the duration of signaling as shown in this graph here. I can help with mechanism of action study design and identifying the best CROs for advanced pharmacology and also for more routine compound profiling. I also run seminars and training sessions to help your team understand the fundamentals and the latest advances in pharmacology. Check out my YouTube channel for some examples here. If you believe I could help in moving your projects forward, please get in touch. We can meet to quickly establish if my services would be useful to you. For more information, please see the website of my consulting and data analysis company, Pharmacanics. To view my scientific experience, please see my publication list on Google Scholar. Thank you for your time and attention.